Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Welcome to our podcast, Cannabis Legalization. Is it progress or patchwork? As cannabis legalization continues to evolve, not just here in the States, but across the globe, as healthcare professionals, we definitely face some new challenges and opportunities in patient care and public health. So in this episode, we're going to explore the implications of cannabis legalization and really examining whether it represents progress or a patchwork of policies. Now, with over 40 countries having legalized medical cannabis and more than 20 states in the U.S. actually allowing recreational use, the landscape is definitely changing, and it's changing rapidly. And so it's not just a legal issue, it's a healthcare issue. It's going to affect how we manage pain, mental health, chronic conditions, and it even influences patient decisions and societal norms. Studies have shown that cannabis use has increased by 30% in regions where it has been legalized. And I think that really highlights the need for healthcare professionals to stay informed and proactive. And this shift definitely has some significant implications for clinical practice, for patient education, and really public health policies and public health education. So joining me for this discussion is Dr. Frances Maynard. Frances, thank you for being here.
Oh, thanks for having me.
Yes. Can you share how you became involved in this topic?
The way it was more of a personal issue, in that I had a friend of mine whose child was attending the university where I was teaching, and he was telling me about the problems that this child, new freshman at the university, was having in using medications that he had been legally given. This child had numerous issues over the years and was put on or authorized to use medical marijuana for his issues. And the problem is that this kid was at the university, and when he would need the legal substance, he had the medical marijuana card, allowing him to hold and use this substance. The university said that he was not allowed to use this substance on campus, and that he was not allowed to store this substance on campus. And they had reached out to the health services piece of the university and said, "Will you all handle this for us? Can he store it here such that if he needs it, he can come to health services?" And as it turns out, that was not accessible to him either. And what the family was told was that the child was allowed to live in the dorms, but was not allowed to store the cannabis, was not allowed to have the cannabis anywhere on campus, and that if his symptoms warranted needing this substance that he'd been using for a number of years under the care of various physicians, that the parents would have to drive across the state with the substance, take the child out of the dorm, off university property, let the child use the substance, and then drive the kid back to his dorms. At that time, recreational marijuana was not legalized. It was only medical marijuana that had been legalized. And the father's concern, aside from his child not being able to access a substance that he had been using, was that the father said, "I don't have the medical marijuana card. If I put this in my car and I'm driving across the state to give this to my kid," he was concerned about that. So that was how I became interested in it. And speaking with other colleagues, we were totally thrown by all of this, did not know that this was an issue. So then reaching out to other universities and learning that there's a whole lot more to it than just um, saying that someone has the medical card and they can use it, marijuana, whenever they need to.
Right. That is such an interesting story. And so many places in your story where I feel like this child was failed
Yeah.
by the healthcare providers, by, the university administrators. I mean, he has a medical card for this. This is a prescription pretty much, not recreational use. Um, and so how they got away with not even giving him a way to use the medication that he needed,
Right.
that,
Right.
that is.
It was, yeah. And so it was interesting because then talking to others about this whole issue, it was like, well, I mean, kids are in college. Why didn't he just hide the cannabis under his pillow like all the other kids
Right.
do? Right.
Yeah.
But this situation, it was not.
But he was trying to be honest and
Yes.
straightforward. He wasn't hiding what he
Right.
needed. I mean, this was a medical
Right.
use,
It was a medical use.
approved medical use,
Yes.
So I respect him for trying to do the right thing. That
Yes.
says so much about him and his character. And
Yes.
I just it breaks my heart to hear
Right.
how we failed him. From the university administrators to the healthcare providers who should have been like, hey, yeah, we'll help you. This is medication. You can come to most universities have like clinics
Right.
on base,
That's what he tried
on campus.
Yeah. That's what he tried to
um,
do. Right. Right.
so there were so many avenues where he could have been helped, and accommodations could have been made, should have been made.
Well, according to the federal law, that's not possible. So that's ultimately what the issue was.
Well, let's get into
Yeah.
that. So, my goal for our discussion today is really just equipping us healthcare professionals with that knowledge and the strategies to navigate exactly what you're talking about, this landscape of, federal laws, state laws, choices that, I don't even know what you call them, policies for, places like the university, just to be able to make informed decisions in our practice and also to help our patients navigate this landscape, because it's definitely different.
Yes.
So
Yes.
to kick us off, what are the current trends in cannabis legalization and how do they vary across the different regions?
What is interesting is that it's very much, very, very much a state by state. It's a state by state landscape. Even one state next to the other. Some are have authorized use of medical cannabis. Some have authorized use of recreational. Some have said no to both. And each state, even if they have legalized use of medical cannabis, they all have different formulations and different amounts and different ways that patients can access it, which is very interesting in and of itself. It's very much a way of, for a while there, it seemed that more and more states were authorizing use of medical cannabis, allowing it. And certainly more than 3/4 of the states are now allowing medical cannabis in some way. But even state by state, the amount that people can access and the varietals that people can access are very different depending on the state. And then it was one of the biggest issues was that because it is currently a Schedule I substance federally, that no research, very, very limited research is able to be done used on the substance. And so there was, in Biden's term, a thought to reschedule the cannabis from from a Schedule I to a Schedule III, which will allow more research on the substances in the whole cannabis plant because there's so many different substances within it. And then what happened with that was that, then candidate Trump was all for rescheduling and he pushed legalization actually in Florida. And I think it might have been only a week before Trump was inaugurated, put into as president. A judge put a hold on the rescheduling. So even though then candidate Trump was for legalization, the people he appointed at the DEA and at the Office of Management and Budget were very much against rescheduling cannabis as a Schedule III drug. So where it is now, it's kind of in limbo in terms of rescheduling. So even though there seems to be a very broad public support and almost like a wink and a nod with people using it, that policies are very much on the other against that, right? So it's not only we saw with that kid at the university, but it's true for things like and so the child with the university. The issue is that universities get federal funding, and so universities were afraid of losing any kind of federal funding. And that would mean not only grants for their researchers, but scholarships for other children going to the universities, because all that stuff is federally regulated. So there's the universities. And then in addition to that are the people living in public housing. So public housing gets federal monies as well. So for those individuals living in public housing that are subsidized by federal monies, those individuals as well are not allowed to use medical marijuana if they are deemed eligible for it. So there's a whole bunch of political things happening, weird things happening.
Yeah. And so people are tiptoeing around these
Absolutely.
federal regulations to try not to have any negative repercussions on them. It sounds like more of the monetary
Yes.
areas.
Absolutely.
We don't want to lose our funding, or or them to decrease our funding. It's just interesting that medical cannabis is put in this position.
Yes. And part of it too, what I think is interesting is that one of the the big pushes for getting cannabis legalized was states saying we can make money off of this by taxation, and we can get this. And what's happening in various states, I mean, it's very interesting on a very state by state basis. What's happening in various states are states saying, with every time that they're trying to increase, for example, taxation on this, what's happening then is they're competing with the illicit market. And so states are saying we're not getting the monies theoretically that we should be getting, because if it's not legal, it's very, very interesting. It's very interesting, I think.
There's a lot of red tape there too. It
Absolutely.
sounds like.
Absolutely. Absolutely. Absolutely.
Now, one of the things that you mentioned that I want to touch on is, the reclassification. So right now, Schedule 1, trying to make it a Schedule 3. As far as the potential benefits and the risks of cannabis use from a healthcare perspective, what do we actually know? Because I know that the studies are, we don't have as many because
Right.
it's a Schedule 1 versus a Schedule 3. So what do we actually know when it comes to the potential benefits and the potential risks?
So what's interesting about that too is that it depends on who you read, and different organizations have said different things. So the only definitive thing that we know is that for some forms of epilepsy, that it reduces seizures. We know that, yes, it can help with cancer-induced nausea and vomiting. And we know that certain forms of spasticity, like in multiple sclerosis or spinal cord injuries, that it definitely can help with spasticity there. There have been, what is interesting is that, so we as providers cannot prescribe, right? We can authorize if someone meets qualifications for needing or benefiting from cannabis. Each
Right.
state has its own indications for who qualifies for it, right? So the interesting thing about that too is that because different states and different organizations have said, yes, it works for this, then really providers are really working in the dark because if my state where I live say that this is medically called for because of this condition, your state might say something very, very different. So that's part of it, is that we don't know a whole lot. One of the things with this too is that it's different formulations of the cannabis, right? So there's the THC and there's the CBD, and so how those are the proportions of each in what is given to a person. CBD affects people in a very different way than THC does. So a higher CBD might be useful more for someone suffering from inflammatory diseases versus THC, which works on a different part of the whole system. So even with, it's very confusing trying to figure that stuff out. And then one of the things that we've seen, so we know that it works to reduce anxiety in some, right? But that's for a higher CBD versus THC. But THC in some people can cause severe anxiety. So it's just a very strange world that we're living in. And there are certainly, benefits for medical cannabis seen in a number of populations. The issues become one of the things that we are concerned with is that if people are using it, it can result in things like cannabis use disorder, people becoming dependent on it, using it more, having problems with anxiety. If people are prone to psychiatric illnesses, psychosis, it can induce psychosis in some individuals who are predisposed to that. One of the things that, so I'm a family nurse practitioner. So one of the things that I'm concerned with that I see are the use of edibles that look like candy, right? So with packaging for that, with kids getting a hold of something that look like candy, but it's marijuana.
It's not.
Yeah, yeah. So I mean, there's a lot of advantages and potential advantages to using this as medication, but there's a lot of issues and real issues. And the problem is that without true research and overall legalization, it makes it very, very difficult to even have conversations with patients about what the potential benefits and issues are. So with people saying that, and it does, it works for in reducing cancer-induced nausea and vomiting, cachexia, etc. but persons who are pregnant might think, oh, it reduces nausea and vomiting. And if I'm having nausea in my first trimester, then maybe I should be using edibles. But the issue is that THC crosses the placenta, so they definitely should not be. So part of it is, there's not enough information that is out there and that
And we
people
don't have
know.
guidelines.
Exactly. We do not have
There's no
guidelines.
prescribing guidelines. Now, what about the other, there's other countries where it has been legalized. Are they leading the way in research?
They are doing more so Germany is one, for example, that is more, uh, not liberal, but they have more of an overall vision. It's not localized. I don't know what it is in Germany. It's not county. What is it in Germany? There's how we have states?
Yeah.
Yes, it is not that way in Germany. It is not that way in Mexico. There was for a time a number of countries that were, again, like you say, leading the way for this kind of legalization and for research with. But given the political environments that we're seeing in this country, we're seeing in other countries as well. So it is less, it is not on the radar in the same way as it was even 10 years ago.
That's so interesting. The way that we're looking at cannabis and all of these.
Yes.
I mean, you could be trying going on vacation and you need this, you need the medical cannabis and you go to a different state. You're trying, even driving through different
Yep.
states, you need to know what those laws are,
Right.
what you're allowed to do.
Right. And so if I have a card, a medical marijuana card, like my patients call it, I can't go to a different state and use it if that state has not legalized it. My card in my state is not valid in your state.
So how do we navigate these legal and ethical considerations that we're identifying that we're seeing? How as healthcare providers do we navigate this?
I think part of it is so you've seen, I'm sure, that the numbers and numbers of CMEs and CEUs that have gone out. There is the American Nurses Association has promoted legalization of cannabis. They have a number of textbooks now out about this. So part of it is the whole education piece that has to be done. But I think that one of the things that is problematic is if we focus on the education with all the and only the physiologic, pharmacologic, those kinds of issues. One of the big things that we really, really need to be paying attention to are the legal aspects, like um, things like going across state lines, things like, so what is interesting is or for me, what I hear are my patients wanting me to authorize them to have the card, right, for various issues, right? And they don't know that if someone has, if they're legally they have legal access to cannabis, it does not mean that cannabis is free. So I have patients saying, oh, if I have the card, then I can get it for free. And so, et cetera, et cetera. So part of it is that issue is education. So healthcare providers, I think we need to be really, really well educated enough to speak to our patients about not only physiologic, pharmacologic things, but also the legal aspects of this. Part of it too is the thing that especially if you're in a state where it is legal, recreational, or medicinal, that persons are getting their cannabis through dispensaries and not randos on the street, right? So that's one of the issues, is that at least we know that from a dispensary standpoint, that the substances they're getting are in some way regulated, and not with various substances also put in
Right.
there.
They're usually on the street laced with other things.
Absolutely.
Um, but it's so interesting talking about the education that you have to have, or that you should provide. I mean, when you think about, oh, I'm going to authorize you to have a card, you're not necessarily thinking that you also need to educate them about all these different laws, the state laws, and all the, you're thinking side effects and the reason to use it, and I put this up so other people can't get to it, type of thing.
Right.
But now healthcare providers have to be responsible in understanding and knowing the laws that surround, because where else is our patient going to get that information? I don't think the
Right.
dispensary is necessarily going to share that. They're in the money making business. They're
Right.
out to sell it. So I don't know that they're going to be responsible. I mean, some might. I don't want to speak for all of them, but where else is that patient going to receive that information they need so that they don't get in trouble with the
Right.
law, going on vacation, driving through other
Right.
states? And, so there's definitely a piece of this that we need to start understanding
Absolutely.
and making sure that we're sharing with our patients, because we don't want them to get in trouble.
No. And absolutely. And so one of the things that you just alluded to, which I think is interesting as well, is that um, as providers, we are not saying you should be taking, 50% THC and 50%, CBD, and this is the plant. This is how I want you to be taking this. We're not. All we are doing is saying, if someone is getting the legalized cannabis, all we are saying is that we agree that this patient
May
meets this
benefit.
medical condition, right, and may benefit. And what's happening then? So if I say that for one of my patients, I am not saying to my patient, you should really be looking for this kind of dosage, right? What's happening is that patients are going to dispensaries, and that's where they're getting the advice about which um, thing to smoke or which edible to use. It's the dispensary people who are giving that advice,
Well, how do
because
they know?
they do some training. It's really it's a wild west out there. It really is very
Right.
interesting. Yeah.
Yes. Because are we doing studies on like the different types and the percentages, and are there studies to try to help with narrowing it down, THC versus CBD
Yes.
versus?
That does exist. Yes. But if you're a provider and you are authorizing one of your patients to use this, you there is no prescription pad saying, I think you should be using sublingual versus vaping versus whatever and looking for this percentage. That doesn't happen. You are just basically authorizing. You're saying to the patient, this is what um,
Who's leading the studies for THC versus CBD? I mean, just is it a different country that really is leading the studies to help us understand?
yeah, there has been a lot of stuff in the United States that has been done. It's very extremely regulated, because the uh, plants that we can get to do this research are in one place, and the researchers have to be doing, going through all of this stuff to be able to access this and to be able to get that information. So it's a very onerous process, and very few universities are allowing that research to even take place.
Yeah. What other challenges are you seeing as far as being able to conduct research on the medical use of cannabis in these different regions? Because, we have the varying legal statuses.
Mhm, mhm.
So, what other challenges are we seeing?
I think that is the biggest one is that I think that a lot of us were almost kind of flying blind in
Hmm.
that we know some things about what CBD versus THC. We know some things about that, right?
Right.
We don't know uh, uh, like you're saying, different guidelines. So if even different organizations, right? So the American Medical Association is very much against still legalization of cannabis, but they are for doing research on this, right?
Yeah.
So we need to have more research because we don't know what's going on with that. I think one of the big things as well is like you're saying, the idea that we need to have a broader understanding as providers that it's not just this um, uh, go ahead and use this substance and it will hopefully help alleviate this, but this broader understanding of what you're saying, what it means for the, the the laws where people can use it and where they can live, and just because they are have access to doesn't mean they're not going to be thrown out of their housing. That's
Right.
I think a lot of it is that. Um, I think that one of the ways, the biggest ways, is to like we talked about, really having this education, and that the education has to be very, very um, uh, not just going into the weeds per se of differences between CBD and THC, but there's so much more with that. Um, it's almost like for I don't know, maybe for the past 5 years, it's almost like, oh yeah, people are doing it. But there are real issues, you know, using it as well in terms of, so if we have um, the various, one of the things that we can learn about, or, teach our patients about, if you're going to be using this, um, uh, there's various ways that you can ingest it, right? You can use edibles, you can use vaping, you can smoke it, you can, use whatever, sublingual. And so teaching patients about that as well. The idea that this whole, it's like all the stuff we learned, way back when, you start low, go slow.
Hmm.
So if someone is going to be using this, to recognize you don't want to go for the highest levels at the beginning.
Right.
Understanding from the adolescent perspective that adolescent brains are that's a real potential problem with adolescents using it.
Hmm.
The longer you're exposed to this, the more potential you have for um, issues later on.
Right.
Recognizing too that people are using it. You hear about people saying, "Oh, it's more natural, so I want to use this instead of Lexapro or some kind of drug, for my anxiety." But
Yeah.
recognizing that if you have underlying issues, that it can be a real problem. And so one of the big I don't know, hurdles I think we have is that with the idea of legalization, the idea of medical and or recreational, is that it becomes almost uh, it's there, right? It's saying
Yeah.
this is okay, right? But recognizing that it still is, they really do have potential, really big issues that I think that we can't just take for granted, or make sure our patients aren't taking for granted, that just
Right.
because it's quote unquote natural.
Right. I don't think, I think everything in moderation, is
Yes.
that saying, like
Yeah.
everything in moderation. Uh, I most things have side effects.
Mhm.
You might not see it tomorrow, but you might see it 10 years down the road. And we really don't know what those side effects are going to be
Right.
for even medical cannabis.
Right.
Um, and I definitely think those are things that also our patients need to be educated about as well. Hey, we don't have the research to know what the long term effects of this are. We do have some research that shows that this can be helpful, but we don't know what we're going to be facing
Right.
years
Right.
down the road because we use this, because
Right.
we don't have the research that most of our um, prescription drugs go through
Right.
to be able to identify the side effects and the issues that arise from taking those medications. So I think that's definitely something that needs to be part of that patient education.
Absolutely.
And I don't really know why cannabis legalization has had such a political, I mean, this is like a lot of headbutting, and this is not a political podcast at all. So I don't want to get into
Yeah.
that.
Yeah.
But
Mhm.
I just want to say, we do recognize that this is a topic that is very politically charged. But we think as healthcare providers, we really need to know the the information for our patients to be able to provide the correct information and let them make the best informed decisions. Because if we're not informed, they can't make informed decisions.
Right. Right.
So, when
Right.
it comes to the implications of cannabis legalization, what are the implications when it comes to mental health and addiction treatment? Because we are seeing it in those areas of healthcare.
Well, um, even before we get to that, one of the things, so you had just mentioned that, so patient care and, how we educate people, et cetera. So another thing that I think is really interesting with that is that even if you as a provider were to say that your patient would benefit from medicinal cannabis, and that you and your patient is now taking cannabis medicinally, and you're aware of that and you've documented it, et cetera. If that patient gets hospitalized, they may or may not even have access to that. So it's a very interesting dynamic with that too. So on the one hand, we're saying yes, but on the other hand, we're saying no in terms
We're
of
not going to provide that for you in the hospital. And
yes,
that's interesting too, because if you have a patient that is an alcoholic, and they come in, I can't tell you how many trays I've seen where they would get just a shot of alcohol to keep them
yep,
from going into DTs,
right,
and that was an option, and now we have this in some areas where we have legalization for medical use, yet in some hospital, like if they're hospitalized, they might not be able to
right,
access that.
right. Yes, that is definitely true. That is definitely true. Um, so going back to the, with legalization, if it is, legalized or um, nationally, one of the things that I think is a benefit of this is that we have this idea. Um, if it's decriminalized, then what we have is potentially, um, reduced incarceration rates, right? So
Mhm.
if a cannabis offense is nonviolent, then we are potentially, reducing incarceration. The issue, and so we're seeing in different states, even that haven't legalized recreational or medicinal cannabis, they are still, one of the things they're doing is they're decriminalizing it that way. I think one of the big things is that if this is legalized, is that it comes under the umbrella of being able to monitor safety and quality control, right? So
Mhm.
reducing contamination, the whole idea that, you can check for quality of, what you are giving somebody. Um, and potentially one of the things that you can be doing with this is getting funds through tax revenues with other public health initiatives. But On the other hand, like you had mentioned before, is that one of these risks of legalization is that potentially you're having increased use. So if you have this increased availability, you're going to have higher rates of use. And same with, so it's like this, if more adults are using it, then more adolescents are going to be using it. So maybe there's concerns with cannabis use disorder. Certainly the idea of, so we know now, or for a long time now, Mothers Against Drunk Driving, you cannot drive a vehicle, you cannot operate things if you are under the influence of alcohol. And there's ways that, with police officers, you can measure someone's alcohol level. So what does that mean then in terms of cannabis is legalized? How does that work then with people driving if they're impaired with cannabis, and how can that be monitored? One of these concerns, right now, if cannabis is not regulated, the potency of various strains are higher or lower. So people are potentially exposing themselves to very high potency strains of THC, right? And so that's really increased risks of psychosis and anxiety. These early and frequent uses, so this is problems with kids later on, adolescents, with memory and, their own development with adolescence. There's so many things that I think that by doing this in a half format, that we're not able to really monitor and really regulate better for safety of individuals in a public health way.
Well, to even know,
Yeah.
to even understand what is happening. And when you were talking about more increased usage, I was thinking they come to the emergency room and they've
Yep.
been drinking too much. We know what to do. We know how to take care of them. They have used opioids. We know what to do. We know how to take care of them. They come in using marijuana. Do we know what to do with them?
There is a real, unfortunately, we do see a lot of our patients come to the emergency room who have, it's not even a cannabis, it's, what's the name of it? There is a name for this when someone has used too high of a THC, or they have this severe reaction to. So yes, there are ways that emergency departments are dealing with this when this happens, and just recognize
have
that
guidelines
yes,
in that aspect.
For that aspect. Yes.
Okay. So, well, that's good. That's good that we have that. There's just so much that we don't know
Exactly.
about cannabis in general that it is just interesting to me, and the holdup of us not being able to do the research that we need to do, and yet we're saying, oh yeah, we can use this. It's got these benefits.
Right.
But there's so much red tape that's holding us back from being able to really learn how to use this to the best of its ability.
Yeah.
To even understand how we can use this, and to understand how do we say that we're going to inform our patients when we don't even know what the long-term side effects are, because we haven't been able to do that research in order to find it like we can for most of our other medications that we prescribe. Are we seeing this used in pediatric care as well?
Yes, it has been for a long time. Like I had mentioned before, there's some specific types of epilepsy. There's 3 diseases where it has been used in a very different way. That it's recognized that it is useful for this. There was also So I'm in New Jersey. So here in New Jersey, we had this law passed for a remembrance of or in honor of this child who had brain cancer and died and was using uh, medically prescribed cannabis, and allowing, in some cases, for children to have access that way. But again, even though that law was passed here in New Jersey, we were unable to, in different hospitals then, these children who qualify are not able to access that because of federal regulations.
Mm-hmm. So they can access it in the state, but they can't access it federally. And in some areas in the state where it was passed, they can't have access to it.
That's
Makes
correct. That's
makes
correct.
sense.
Yeah.
Yeah, a lot of sense. Actually, I don't understand.
Yeah.
I don't. It's hard to wrap my head around
Yeah.
around all of this red tape when all we're trying
Right.
to do is take care of our patients and to use the things that we know can help them. What were the three disease processes that um, you're seeing it used for peeps?
Oh, I was hoping you weren't going to ask me that. There is a very specific seizure disorder that shoot it's a kids are born with it. I don't remember that one, but also for epilepsy that is not uh, in some children that is not does not work. The usual suspects for those the medications do not
Are
work.
not
So
working.
yeah.
Yeah.
And in palliative end of life care in some kids.
Yeah. Now, how does cannabis legalization affect workplace policies and even like employee health programs? Are we seeing it affect that?
Yes, what is interesting about that whole thing is, so if I am, and that is very varied again, depending on which state you live in. So if I am, so I'm a healthcare provider in the state of New Jersey. New Jersey
Hmm.
currently allows medicinal marijuana use and adult recreational marijuana use.
Okay.
With my state board of nursing, though, um, it is said that I should not be using cannabis, certainly, certainly in the workplace. So even if I have a medicinal marijuana card, I cannot
Hmm.
use it in the workplace. I cannot use it with if I'm going to be working that day. It's a very, very different. It's very interesting because with the various, strains and forms and each of these varying,
Hmm.
concentrations, dosing is very difficult to determine, right? So if I say I'm going to use recreational marijuana, um, and then the next day I'm supposed to go into work, that is against the state board of nursing, right? So it's very, very, it's the state boards are very, uh, they're finding their way with all of this stuff as well. One of the things now with, if people are, for various jobs in terms of, certainly drug screening for a lot of different positions. So
Hmm.
whether or not they're being screened for THC or not, versus cocaine, all the others. So there's that. The idea that for healthcare providers, it's not only healthcare providers, right? So if I am seeing someone who is a school bus driver, and I don't know if I want someone who is, I know I don't want someone who has used marijuana that morning driving my kids to school, right?
Right. Yeah.
But on the other hand, So what does that look like? What are the legal things with something like that? Who are the people that should not be um, given access to medicinal marijuana? Or if they are, what is the form for when can they then go to work after
Yeah.
they've used it? It's very,
Right.
it's, and a lot of that does vary state by state.
Right. So there's a lot of red tape here. So let me see.
Yeah.
You have federal laws and regulations. You have state laws and regulations. You have workplace
Yep.
policies and regulations. And you have licensing body
Yes.
policies and regulations.
Yes.
So you've got to basically go through all four of these to try to figure out if you can use it and when you can use it.
Yes. Yes. Yes.
Mhm.
Yes.
That's a
So
lot.
if we don't know, how can we
Yeah.
possibly expect our patients to know? And the thing
Right.
is that it's, one day it's this, the next day it's this. So it's just like this constant, um, the guidelines are changing. It's very, very, it's very scary. It's very
And it's
scary.
very confusing, and that
Yes.
I think is what makes it so scary as well. Plus, there's so much unknowns that to me makes it scary for me because I want to know if I'm using this now, what does my future look like in 10 years
Right.
potentially?
Right.
Um,
Right.
but how can we advocate for evidence-based cannabis policies and fair regulations? Are we in a place as healthcare providers where we can advocate?
Well, your lips to God's ears. God
How'd we get
knows.
here? I don't know how we
um,
got here.
yeah, I think one of the biggest issues is this whole idea of education, education, education. So we do have to have this, but I think too, recognizing that, I mean, if you right now go on the internet and try to find CEUs or CMEs for um, cannabis education, you're going to find 20,000. There's tons of them. There's tons of people offering certificates in this, and there's majors in various universities for not only marketing but for cannabis itself. So I think that recognizing that like you had alluded to, there's money to be made, right? So the
Mhm.
issues for us as providers are trying to figure out what the
Facts are?
yeah, yeah,
Mhm.
yes,
What are the actual facts
yes, yes,
that are not skewed by money? Yeah.
yes, yeah, yeah. Well, good luck with that. Yeah, yeah,
Yeah. Wow. That's a lot. Well, there's definitely a stigma that's associated
yeah.
with the use of cannabis. So, can we at least address how we can address the stigma itself that's associated with the use of cannabis in patient care?
I think part of it is much like anytime you're doing a basic, health history, right? It's trying to be very non-judgmental, whatever is like a matter of course. You ask someone how much they drink, you ask someone how much cannabis they're using, how they're using it, where they're getting it.
Right.
And these very, very basic, you know, things in a non-judgmental way that it's like part and parcel of the basic health history.
Absolutely. Well, as we come to the end of our discussion, is there anything that you really just want to make sure you emphasize, or even something that maybe we didn't touch on that you think is really important that we should mention?
I think one of and we have mentioned it, but I really do think that there is so much that we don't know in terms of not only, the whole pharmacologic stuff, but the idea that, talking to, various colleagues about these, no one knew that all this stuff was going on, right? You
Right.
think, that it's, oh, people are using it. It's not uh, I really do think that it is so much more than legalize, don't legalize, use it, don't use it. It's not like, drinking a beer on a Saturday night. There's a lot to it, but also a lot for us to realize in terms of implications for patient care outside of, their physical health, but, potentially a whole bunch of other things going on.
Absolutely. So my question for you now as we come to a close is it patchwork or progress?
Oh, I think it's very much patchwork.
Absolutely. I 100% agree with you, that I don't want to say it's like we're flying by the seat of our pants here, but you kind
But
of
we
are.
are.
Yeah, you
Yeah.
really are. It's like, well, I mean, I know that from what we know about this, you could benefit from it, but you've got to now navigate all of this red tape. And I'm supposed to tell you about the red tape, but I don't actually know all of the red tape either. But I know that there's red tape.
Yes. Yes. But also in a way too that it's not just navigating red tape, but it's not just that people are trying to prevent you from getting this because
Yeah.
we don't know enough to say that, right?
Right.
I don't want it to be this, we're the weed queen saying that, yes, you should definitely be using this. And it's the man who's preventing you from not getting it.
Yeah.
But there are things we don't know enough. Yeah.
Right. And I wish that from the beginning, they would have done this the way that we do with our medications and new medications and do actual the 5 steps basically
Yeah.
of the studies, of the different research studies, and then at the end of it you come out and you have evidence-based guidelines on how to use this and what
Yes.
we are seeing the benefits for. Why we didn't do that, I don't know.
Well, the thing is that cannabis has been around for years and years and years and years. So people have
Yeah,
been
but
using it for a very,
now
very,
you're
very long
looking at
time.
it with a totally different lens and view to make it to where we're going to look at this as a type of medication that we can
Yes.
prescribe. So let's go backwards and let's do real studies like this is a new drug because it is.
Yes.
No, it's not new as far as people using it, but looking at it under this lens,
Right.
this filter, it was new. It is
Right.
new.
Right.
They were.
Right.
So I just question why we didn't do it the way we do with the majority of our medications,
No, we're not even doing studies on aspirin anymore or at all, right? So,
Yeah.
Yeah.
Yeah. Well, thank you so much for being here and for really helping us to understand that changing landscape.
Oh, well, thank you for having me.
Yes, this was a discussion that for me just really emphasized the importance of knowing and understanding the benefits and risks of cannabis use. And it really increased my understanding of the legal and ethical considerations that we need to be aware of that, I didn't even know, to help our patients be educated and even to help our communities be better educated.
Agreed. Great.
Yeah. Well, to our listeners, thank you for joining us. And I encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.